let's learn about one of the most favorite topic of examiners in embryology, that is pharyngeal apparatus. If you are a first year student or even if you are writing your entrance exam, your exams are incomplete without a question on the pharyngeal apparatus. You can expect one question in whatever exam you write related to embryology. What exactly is pharyngeal apparatus? When does it appear? Where does it appear? And what are the structures that develop from pharyngeal apparatus? And what happens when the development of pharyngeal apparatus is deranged? Let's try to learn the details of all these aspects now. First, we'll try to learn what exactly is pharyngeal apparatus, where exactly does it appear, and when does it appear. The developing embryo has the embryonic gut, which is divided into foregut, midgut and hindgut. The foregut is divided into prelaryngeal part and postlaryngeal part. The prelaryngeal part lies in the cervical region or the neck region and gives rise to primitive pharynx. Surrounding this primitive pharynx, we have the appearance of pharyngeal apparatus, which include four important components, right? These components include a mesodermal part called as pharyngeal arch, an endodermal component, an ectodermal component, and a region where all three components come together, which is called as pharyngeal membrane. All these can be best identified if we take the coronal section of the developing embryo, and we will see that little bit later, right? So, the first thing we need to understand is where exactly the pharyngeal apparatus appear. This appears in the developing cervical region surrounding the primitive pharynx. When does these appear? The first pharyngeal arch, which is a component of the pharyngeal apparatus, appears at about 22nd day of intrauterine life. Then the second and the third arch develop around 24th day. The fourth and the sixth arches develop around 29th day. This is in general about when exactly the pharyngeal arches make their appearance. The fifth arch either doesn't appear or disappears as soon as it's formed, right? Now, let's see how these pharyngeal arches look when we see the embryo. This is the lateral view and the ventral view of the embryo, where we can see the pharyngeal arches in the developing neck region, that is between the face and the trunk. If we take a coronal section along this region, this is how it looks. So, we have the primitive pharynx in the center, and surrounding that we have the pharyngeal apparatus. Now, let's try to identify what are the components of pharyngeal apparatus. The pharyngeal apparatus will have a mesodermal component which is called as pharyngeal arch. Each pharyngeal arch will contain its own cartilage, its own muscle, its own innervation and its own artery. So, these are the four subcomponents present in pharyngeal arch. So, when we say the term pharyngeal arch, it refers to mesoderm only, right? Done? This pharyngeal arch is lined on the inside by endoderm of the primitive pharynx, and at places between two arches, these endodermal lining will form the endodermal pouches. This is why the pharyngeal pouches are endodermal. Similarly, the pharyngeal arch on the outside is covered by ectoderm, and these ectoderm in between the arches will form grooves. Because they lie on the outside, we call it as grooves, and because the endoderm lies on the inside, we call it as endodermal pouches. So, remember, whenever we use the term pharyngeal arch, we are referring to the mesoderm. Pouch usually refers to endoderm, groove or cleft refers to ectoderm. This is the first thing that we need to understand, right? So, let's talk about these derivatives in detail now. First, let's see about the cartilaginous derivatives. The first arch cartilage is called as Meckel's cartilage, and Meckel's cartilage gives rise to malleus, incus. These are the two major bones that develop from the first arch cartilage. Apart from this, there is a bone called as alisphenoid, which also develops from the first arch cartilage. When the cartilage cells disappear and only the perichondrium remains, wherever such thing happens, we have the formation of two important ligaments. What are these ligaments? Anterior ligament of the malleus and spinomandibular ligament. Right? Spinomandibular ligament extends from the spine of the sphenoid to the lingula of the mandible. Please don't confuse this with the stylomandibular ligament, because stylomandibular ligament is a thickening of the investing layer of deep cervical fascia which separates parotid and submandibular salivary glands. Are we clear? This is regarding the derivatives coming from the first arch cartilage. What about the second arch cartilage? The second arch cartilage is called as Richard's cartilage. What are the structures that develop from Richard's cartilage? Richard's cartilage gives rise to the stapes, the smallest bone in the body. Then it gives rise to styloid process. Then it gives rise to the smaller cornu of the hyoid bone and the upper part of body of the hyoid bone. These are the major bones that develop from the second arch cartilage. Everything begins with the letter S. Stapes, styloid process, the smaller cornu or the lesser cornu of the hyoid and upper part of body of the hyoid. Apart from this, the second arch cartilage also gives rise to the stylohyoid ligament. Right? So, these are the cartilaginous structure that gives rise to various bones and ligaments in the second arch. The third arch cartilage. When we talk about third arch cartilage, the third arch cartilage gives rise to the greater cornu of the hyoid and the lower part of body of the hyoid. What about fourth cartilage? The fourth and sixth arch cartilages are believed to give rise to laryngeal cartilages. The fourth arch cartilage in specific will give rise to the thyroid and the epiglottic cartilage, thyroid and epiglottis. The sixth arch cartilage will give rise to rest of the laryngeal cartilages like cricoid, the corniculate and cuneiform and arytenoid cartilages. Done? So, this is regarding the derivatives of the first arch cartilages. Right? So, remember, the cartilaginous element of the pharyngeal arch gives rise to either bones or ligaments. How the ligaments are formed? When the cartilage cells disappear, leaving only the perichondrium will persist as ligaments. This is regarding the cartilaginous derivatives. Once we have learnt about cartilage, let us talk about the muscular component of each pharyngeal arch. The first pharyngeal arch gives rise to muscles of mastication. Which are the muscles of mastication? The temporalis, the masseter, medial pterygoid and lateral pterygoid. Apart from these four muscles of mastication, the first arch cartilage also gives rise to the mylohyoid muscle, anterior belly of digastric, tensor tympani and tensor velae palatini. So, any muscle that is innervated by mandibular nerve, you can list as the muscle of the first pharyngeal arch. Right? This is regarding the muscles of the first pharyngeal arch. The second pharyngeal arch mainly gives origin to the muscles of facial expression. All the muscles which are innervated by facial nerve develop from the second pharyngeal arch. So, the muscles of facial expression including the muscles of the scalp, that is the occipitofrontalis, then even the platysma, all of these develop from the second pharyngeal arch. Apart from this, the stylohyoid muscle, stapedius muscle, posterior belly of digastric, even these muscles actually develop from the second pharyngeal arch, right. So, the digastric muscle is an example for composite muscle in the head and neck region, anterior belly developing from the first arch, posterior belly developing from the second arch. The muscles of the third arch, there is only one muscle of the third arch, that is stylopharyngeus. The muscles of the fourth and sixth arch is believed to give rise to the muscles of the larynx and pharynx. But again, if we split, the muscles that develop from the fourth arch include cricothyroid, constrictors of the pharynx and levator velae palatini, right. Muscles of the sixth arch, include all the intrinsic muscles of the larynx except cricothyroid. This is how the muscles of different parts of the head and neck develop from the pharyngeal arches. right? Done. Let's see about the nerves. Before we see the nerves of each pharyngeal arch, we must understand the concept of what do we mean by the pre-traumatic nerve and post-traumatic nerve. Every arch is separated by a groove. The groove is called as trench or trema. So, the literal meaning of trema is trench or groove, which is the space between the two arches. So, what is pre-traumatic nerve? Pre-traumatic nerve is the one which arises just above the groove. Post-traumatic nerve is the one which arises below the groove. If you understand this concept, you will be able to tell which is the pre-traumatic nerve and which is the post-traumatic nerve of each arch. Are we clear with this? I will repeat again. If the nerve is present above the trench or the groove between two arches, we call it as pre-traumatic nerve. If it is present after the trench, we call it as post-traumatic. So, usually post-traumatic nerves will traverse along the upper border of the corresponding arch, whereas the pre-traumatic nerve will traverse along the lower border of the corresponding arch. Fine. Except for the first arch, we usually do not define the pre-traumatic nerves. So, for every arch, what we have is the post-traumatic nerve. The post-traumatic nerve of the first arch is the mandibular division of trigeminal nerve, which supplies all the muscles of mastication. The post-traumatic nerve of the second arch is facial nerve. The post-traumatic nerve of the third arch is glossopharyngeal nerve. The post-traumatic of the fourth pharyngeal arch is the superior laryngeal branch of vagus. The post-traumatic nerve of the sixth arch is the recurrent laryngeal branch of vagus. Are we clear? So, fourth and the sixth arch is ultimately supplied by vagus nerve, but by means of two branches, superior laryngeal and recurrent laryngeal. What about pre-traumatic nerves then? The first arch has its pre-traumatic nerve as the chorda tympani. As we know, chorda tympani is responsible for carrying the taste sensation from the anterior 2/3 of the tongue and also secretomotor fibers to the submandibular salivary gland and the sublingual salivary gland. So, usually when we define the pre-traumatic nerves, it is defined only for the first arch. But in your viva, if you are asked about what about the pre-traumatic nerve of the second and the third arch, remember the tympanic branch of the glossopharyngeal nerve and the auricular branch of vagus are considered as the pre-traumatic nerves of the third and the fourth arches. Done? This is regarding the pre-traumatic nerves and the post-traumatic nerves. But what you need to remember, all the nerves that innervate the muscles of the pharyngeal arches are post-traumatic. There is only one pre-traumatic nerve for the first arch, and that is the chorda tympani. The last subcomponent of the pharyngeal arch or the mesoderm is the arteries. So, each pharyngeal arch artery in the embryonic life connects the dorsal aorta with ventral aorta. Again, we have 6 pairs of pharyngeal arch arteries. Usually the fifth one either disappears or never appears, right. So, ultimately we are left with 5 pairs of pharyngeal arch arteries which connect the ventral aorta with 2 dorsal aortae. Now, what is the fate of each pharyngeal arch artery? The first pharyngeal artery and second pharyngeal artery, most of it will regress. Only part of it will persist. The persistent first arch artery will give rise to maxillary artery. The persistent second pharyngeal arch artery gives rise to stapedial artery. Remember, majority of the arteries disappear, leaving out only a small component which is seen as maxillary artery and stapedial artery respectively in the first and the second pharyngeal arch. The third pharyngeal artery on both the sides will give rise to common carotid artery and internal carotid artery. Fine. Where exactly the external carotid artery comes from? Remember, this is developed from the dorsal aorta. We will learn about the development of the arteries of the head and neck in the chapter of the cardiovascular system development. But for time being, the third arch artery gives rise to common carotid and internal carotid on both the sides. Done. What about fourth arch artery? Fourth arch artery on the right side gives rise to part of right subclavian artery. On the left side gives rise to the arch of aorta. Right? Then fifth arch artery has disappeared. Sixth arch artery. The sixth arch artery has a proximal part and a distal part. Right? Here we need to remember the development of one important nerve, that is recurrent laryngeal nerve. The recurrent laryngeal nerve arises as a branch from the vagus and usually hooks around the distal part of the embryonic sixth arch artery. Right? The distal part of the embryonic sixth arch artery disappears on the right side. So there is no segment derived from the distal part of right sixth pharyngeal arch artery. Because of this, the recurrent laryngeal nerve moves up and hooks around which arch artery? The fourth arch artery, which is giving rise to the subclavian artery. Are we clear? So this is why the recurrent laryngeal nerve on the right side hooks around the subclavian artery. Whereas, let's see about the left side sixth pharyngeal arch artery. The left sided sixth pharyngeal arch artery on the distal side give rise to the ductus arteriosus, which connects the pulmonary trunk, the left pulmonary trunk with arch of aorta. Because of this, the left recurrent laryngeal nerve will hook around which artery? The ductus arteriosus, which in adults is represented by ligamentum arteriosum. Now this is one question you will get if you get the model of pharyngeal arteries for discussion in your embryology viva. What is the reason behind the differential course of right recurrent laryngeal nerve and the left recurrent laryngeal nerve? The reason for that is initially the recurrent laryngeal nerves will hook around the distal part of sixth pharyngeal arch arteries, which on the right side disappears, ensuring that the recurrent laryngeal nerve arch artery moves up and hooks around the fourth arch artery, which will give rise to subclavian artery. Whereas on the left side, it hooks around the ductus arteriosus, which is the derivative of the distal part of the left sixth aortic arch artery, and hence this has a thoracic course and hooks around ligamentum arteriosum. Are we clear? Right. What about the proximal part of the sixth arch artery? The proximal part of the sixth arch artery will give rise to the right and the left pulmonary trunk respectively. Are we clear? So in pharyngeal arch arteries, apart from remembering the derivatives of each arch arteries, we must learn why the course of recurrent laryngeal nerve differs on the right side and the left side. Hope it is clear now. Right? This completes the derivatives of pharyngeal arches. Remember, only the mesodermal component of the pharyngeal apparatus. Now, let's talk about the endodermal derivatives of pharyngeal apparatus. As we said, endoderm lies the inner aspect of the pharyngeal arch, and the spaces between the first, second or second and third is invaginated, and these are called as endodermal pouches. What are the derivatives of endodermal pouches? The derivative of the first endodermal pouch or the first pharyngeal pouch is tubotympanic recess. As the name suggests, tubotympanic. This gives rise to the middle ear cavity, mastoid antrum, and then the eustachian tube or the auditory tube. So these are the three structures which develop from the first pharyngeal pouch. Are we clear? What are the three structures? The middle ear, the mastoid antrum, and the auditory tube. Let's see the second pharyngeal pouch. Majority of the second pharyngeal pouch gets filled with solid endodermal cords of cells and usually gets obliterated. But this ultimately gives rise to the lining epithelium of the palatine tonsil, and the lymphocytes proliferate later. So the derivatives of the second pharyngeal pouch, it is the palatine tonsil, especially the mucous lining. Done? Right. What about the third pharyngeal pouch? The third pharyngeal pouch has a dorsal component and a ventral component. The dorsal component gives rise to the parathyroid 3. Ventral component gives rise to the thymus. What happens to these derivatives later are, these derivatives are dragged down with the development of the thymus. Thymus, even though it develops in the neck, ultimately has to get resided in the superior mediastinum. So the thymus basically descends down. As the thymus is descending down, it actually drags the parathyroid glands together. So parathyroid glands which develop from the third pharyngeal pouch are called as parathyroid 3 or inferior parathyroid. This is a peculiarity. So the inferior parathyroid develops from the third pharyngeal pouch, whereas the superior one develops from the fourth pouch. Are we clear? Right. This is regarding the derivatives of the third pharyngeal pouch. What about the fourth pharyngeal pouch? The fourth pharyngeal pouch again has a dorsal element and a ventral element. The dorsal element will give rise to parathyroid 4 or superior parathyroids. The ventral element usually unites with a small rudimentary pouch which is called as the fifth pouch, forming the caudal pharyngeal complex. The caudal pharyngeal complex will have the ultimobronchial body, right? Now this ultimobronchial body gives rise to two important structures. The main structure that develops from the ultimobronchial body is the parafollicular cells or the C cells of thyroid. In addition to this, there is a small thyroid element which incorporates into the main thyroglossal duct. The development of the thyroglossal duct ultimately leads to the development of the adult thyroid. A small component of that is derived from this caudopharyngeal complex. Are we clear? So this is what we must remember regarding the development of the pharyngeal pouches and its derivatives. Regarding the third pouch, remember, thymus and the inferior parathyroid develop. Since the thymus descends into the mediastinum, it drags the inferior parathyroid together with it, and this is one of the reasons why the parathyroid glands, the inferior parathyroid glands, are often inconsistent in position. Are we clear? This is regarding the endodermal derivatives of the pharyngeal apparatus, pharyngeal pouch derivatives. Let's talk about the ectodermal derivatives now. The ectoderm covers the outer surface or the external surface of the pharyngeal arches, and in between the two arches it gives rise to a cleft called as pharyngeal cleft or pharyngeal groove. Now only the first pharyngeal cleft gives rise to an adult derivative, and that is the external acoustic meatus, whereas rest of the pharyngeal clefts are obliterated. How? The second pharyngeal arch element overgrows rest of the pharyngeal cleft and fuses with the sixth arch, right? The small space which is present related to all the three clefts is called as cervical sinus, which later gets obliterated. If this space does not get obliterated, it leads to cervical cyst or branchial cyst. If it opens into the exterior or the interior, it can give rise to cervical fistula or branchial fistula. Are we clear? So the first pharyngeal cleft gives rise to only one important structure in adults, and that is the external acoustic meatus, right? Rest of the clefts get obliterated because of the overgrowth of the second arch element which fuses with the sixth arch, obliterating all the cervical clefts. If these clefts are not obliterated, it gives rise to branchial cyst, or if there is a connection established, it gives rise to branchial fistula. Are we clear? Let's see what happens when the cervical sinus does not disappear. When the cervical sinus fails to disappear, the first important condition we have is the branchial cyst, right? It's a fluid accumulated swelling which is seen on the lateral side of the neck, usually along the anterior border of sternocleidomastoid. Fine. So if we have a swelling in the anterolateral region of the neck in front of the sternocleidomastoid which is present since birth, most likely to be cervical cyst or branchial cyst. If this cyst opens into the exterior or interior, we call it as fistula, which is called as the branchial fistula or cervical fistula. Usually the fistulous tract passes between the two branches of the common carotid artery before it opens on the exterior. Whenever present, it leads to discharge. Are we clear? So this is regarding the abnormalities associated with incomplete or failure of complete fusion of the cervical sinus. Done. The fourth important component of the pharyngeal apparatus is the pharyngeal membrane. What is pharyngeal membrane? Pharyngeal membrane refers to the region between two arches where all the three germ layers have come together: an outer ectoderm, middle mesoderm and inner endoderm. So pharyngeal membranes will have all the three germ layers. Now here is the clue. Which is the structure in your head and neck region that develops from all three germ layers? And your answer is tympanic membrane. Let's see the position of the first pharyngeal membrane. The first pharyngeal membrane lies in between the ectodermal cleft, which is giving rise to external acoustic meatus, and the endodermal pouch, which is forming the tubotympanic recess. And the parts that develop from tubotympanic recess: middle ear cavity, mastoid antrum and auditory tube. So there is a thin membrane separating external acoustic meatus and the middle ear. And what should be that membrane? Tympanic membrane, right? So the pharyngeal membrane gives rise to tympanic membrane. First pharyngeal membrane gives rise to tympanic membrane. The ectodermal component gives rise to the outer cuticular layer. The mesodermal component from the arch gives rise to the middle fibrous layer, and the inner endodermal component gives rise to the inner mucous layer of tympanic membrane, right? So this is how the tympanic membrane develops from all the three germ layers in the pharyngeal membrane. Done? Are we clear? So this is regarding the derivatives of the first pharyngeal membrane. Since rest of the pharyngeal clefts get obliterated, there are no important structures that develop from the other pharyngeal membranes. So there is only one pharyngeal membrane derivative, and that is tympanic membrane. Are we clear? Right. So this completes the discussion of the derivatives of pharyngeal apparatus. Now, once we have learnt about the detailed anatomy and the derivatives of the pharyngeal apparatus components, let's talk about the clinical syndromes that are associated with them. The first of the clinical syndrome we have is the Treacher-Collin syndrome. The Treacher-Collin syndrome is an autosomal disorder caused due to the defect in the gene TCOF1, which is responsible for synthesis of a protein called as trichial. The characteristic clinical features of Treacher-Collin syndrome includes the malar hypoplasia due to underdevelopment of zygomatic arch. Apart from this, the palpebral fissures show an outward and downward slant. The external ear are ill-developed. These are the three major clinical sets of symptoms that affect the Treacher-Collin syndrome. The second syndrome that affects the first arch development is the Pier-Robin syndrome. Now, Pier-Robin syndrome occurs as a de novo condition. It is not genetically inherited as such. Very rarely it is inherited as an autosomal recessive trait. Now, what are the characteristic clinical features of Pier-Robin syndrome? The characteristic feature is the mandibular hypoplasia. In case of Treacher-Collin, it is maxillary hypoplasia. Here it is mandibular hypoplasia, right? So there is micrognathia or small mandible or small jaw. Apart from this, these patients may have cleft palate or a high arched palate, and because of these defects, their tongue appears large and appears pushed backwards. So this condition where the position of the tongue is shifted backwards is called as glossoptosis, right? This is the posterior displacement of the tongue, which can cause respiratory obstruction, right? So this is called as Pier-Robin syndrome. The third important syndrome that is associated with the pharyngeal arch development is DiGeorge syndrome associated with chromosome 22. Now this syndrome is characterized by congenital absence of the thymus and the parathyroid gland. Which parathyroid? Mainly the inferior parathyroids, right? So the congenital absence of thymus and parathyroid gland is what we call as DiGeorge syndrome. The absence of thymus will predispose the children born with DiGeorge syndrome to infections. They are very prone to infections because of the absence of thymus. Remember, thymus is a primary lymphoid organ responsible for training of T lymphocytes. Apart from this, these children will also have symptoms of the hypoparathyroidism. Apart from this, one more important clinical feature you can identify here is the low set ears. What do we mean by low set ears? When the attachment of the ear is below a line drawn from the inner angle or the medial canthus of the eye. So if I draw a horizontal line from medial canthus of the eye, the attachment of our ear is actually above or mid set. If it is below this line, we call it as low set ears. These are some of the important clinical syndromes that are associated with the development of pharyngeal arches. Questions on this in your theory exam may be unlikely, but you can get a lot of questions in your entrance exam as MCQs. Are we clear? So this is regarding a comprehensive discussion and description of the entire pharyngeal arch apparatus, right? So let's quickly summarize. Pharyngeal apparatus appear in the developing cervical region as the mesodermal bars, which are covered by ectoderm on the outside and endoderm on the inside. These are present surrounding the primitive pharynx. The first arch makes its appearance on day 22, second and third arch make its appearance on day 24, whereas the fourth and sixth appear on day 29. The pharyngeal apparatus includes a mesodermal component called as the pharyngeal arch, the endodermal component which will form pharyngeal pouch, ectodermal component which will form pharyngeal cleft. Each pharyngeal arch will have a cartilage, a muscle, a nerve and an artery. The cartilages derived from the first arch include the Meckel's cartilage, which gives rise to malleus, incus mainly, and alispinoid. The ligaments that develop from the first arch cartilage, the anterior ligament of the malleus and sphenomandibular ligament. The second arch cartilage gives rise to the stapes, styloid process, smaller cornu of the hyoid and upper part of the body of the hyoid. Along with this, the stylohyoid ligament. The third arch cartilage gives rise to the greater cornu of the hyoid and lower part of the body of the hyoid. Fourth arch cartilage gives rise to the thyroid cartilage and epiglottis. The sixth arch cartilage gives rise to rest of the laryngeal cartilages. The muscles of the first pharyngeal arch include the muscles of mastication, anterior belly of digastric, mylohyoid, tensor tympani and tensor veli palatini. Muscles of the second pharyngeal arch include all the muscles of the facial expression, stylohyoid, stapedius and then posterior belly of digastric. Muscle of the third arch is stylopharyngeus. The muscle of the fourth arch is cricothyroid, levator veli palatini and the constrictors of the pharynx. Muscles of the sixth arch include all the intrinsic muscles of the larynx except for cricothyroid. The nerves, nerve of the first arch is the mandibular division of the trigeminal nerve, second arch facial nerve, third arch glossopharyngeal nerve, fourth arch the superior laryngeal branch of vagus, sixth arch it is the recurrent laryngeal branch of vagus. All these are post-traumatic nerves. The nerve of the first arch, which is also called as the pre-traumatic nerve of the first arch, is cauda tympani. The tympanic branch of the glossopharyngeal nerve and auricular branch of the vagus are also considered as pre-traumatic nerve of their respective arches. Arteries, the first arch artery and second arch arteries usually disappear, giving rise to maxillary artery and stapedial artery. Third arch artery on both sides gives rise to common carotid and internal carotid. Fourth arch artery on the right side gives rise to subclavian, on the left gives rise to arch of aorta. The sixth arch artery, the proximal part on both the sides gives rise to the pulmonary arteries, whereas the distal part of right sixth arch artery disappears and the left distal sixth arch artery forms the ductus arteriosus, which forms the anatomical basis behind the differential relation of the right and left recurrent laryngeal nerves. The first pharyngeal pouch gives rise to tubotympanic recess, which gives rise to the tympanic cavity or the middle ear cavity, the mastoid antrum and then auditory tube. Second pharyngeal pouch gives rise to palatine tonsil. Third pharyngeal pouch gives rise to inferior parathyroid and thymus. Fourth pharyngeal pouch gives rise to the superior parathyroid and the ultimobronchial body. The first pharyngeal cleft gives rise to the external acoustic meatus. Rest of the clefts get obliterated, forming the cervical sinus, which later on fuses, giving rise to the smooth contour of the neck. Persistence of cervical sinus can lead to branchial cyst or branchial fistula. The first pharyngeal membrane will give rise to tympanic membrane. Rest of the pharyngeal membranes obliterate. There are three important clinical syndromes that are associated with the development of the pharyngeal apparatus. One is called as the Treacher-Collins syndrome, which is characterized by malar hypoplasia, the Pier-Robin syndrome, which is characterized by mandibular hypoplasia, and DiGeorge syndrome, which is characterized by congenital absence of thymus and parathyroid glands. This is regarding a comprehensive description of the pharyngeal apparatus. The possible questions, plenty of MCQs. You can expect MCQs in every exam from this chapter, especially the derivatives of pharyngeal arches. Derivatives of pharyngeal arches, important 5-marker question. Derivatives of pharyngeal arch arteries, important 5-mark question. Derivative of pharyngeal membrane, pharyngeal cleft, pharyngeal pouch, all of these are short essays or short answer. If you are writing your first year exam, you will definitely get a question of 5 to 8 marks from this topic itself. So please don't ignore and ensure that you have learned the concepts of pharyngeal apparatus very well. That's it for this session. Thank you.